Liza Maria Waka-Tunado died at the weekend after allegedly being stabbed by a man who was treated at a secure psychiatric facility at Hillmorton Hospital, this in Christchurch. He was on community leave, but officials have not so far said why he was on community leave. The Herald this morning is reporting this, that there was a briefing on January 20. Officials at the Ministry of Health told the Minister, Andrew Little, that the workforce at the Canterbury Regional Forensic Mental Health Service was so stretched that its secure psych facility at Hillmorton Hospital was operating only 12 of its 15 beds and, quote, running a wait list for acutely unwell patients. The Health Minister is Andrew Little. He's with us this morning. Minister, good morning.
Good morning, Ryan.
Have you got any comment about this report this morning?
No, I don't. What I can say, obviously, to the family who's lost a loved one, my thoughts are with them, my condolences are with them. Yesterday, I asked the Director of Mental Health, which is a statutory role within the Ministry of Health, to assure me that the situation in which an inpatient at the mental health facility in Hillmorton had been released into the community would be fully investigated. The release of an inpatient is a clinical decision. We need to know the circumstances in which that decision was made, because we know, obviously, now that members of the public were put at risk.
So what you're saying, when you say clinical decision, nobody has been released from this facility because there is a shortage of staff or beds?
Not that I'm aware of. I think in this particular instance, a decision to release a person who is an inpatient, and I suspect they're under the Mental Health Act, that's a decision that a senior clinician needs to make. So the basis in which that decision, I think, needs to be clarified, and that's what I've asked, an assurance that there be an investigation into.
Right.
You have to be a little bit careful. There's a police investigation into this as well. So
yeah,
we've got to make sure that whatever
absolutely
happens doesn't cut across that.
At this facility in particular, though, there were concerns raised, according to the Herald this morning, concerns raised about to your office. You knew about this. So have any of those staffing issues been resolved?
Well, I was aware that forensic mental health services in a number of places in the country were under pressure. I had that brought to my attention at the end of last year, which I raised directly with the Director General of Health.
Have they been fixed?
At the time. Well, it's for the Director General of Health and indeed the Director of Mental Health to work with the mental health facilities to make sure that
you didn't follow up.
What they're doing is within their Ryan, if I could just finish answering your question, this is a very serious matter. And I take it very seriously, which is why I responded in the way that I did yesterday. So, and in fact, when I became aware of the pressures on the forensic mental health services, I took it up at the end of last year in the way that I did. So,
but what I'm asking the Minister is, have you followed up?
No, Ryan,
since?
you haven't let me finish answering the question, so I'm going to continue to answer the question that you've asked me, that you've interrupted me twice on now, because this is an important issue. So it is for the Director General of Health and the Director of Mental Health is to make sure that the forensic mental health services are working within their capacity, particularly when they're dealing with inpatients, people who are there under an order of the court or other order under the Mental Health Act, is that they're getting the care that is required.
Yeah, you know, you're just explaining how the system works. We all know how it works. What I'm asking you is, as Minister, have you followed up to make sure that the issues that they raised are being addressed, have been addressed? Can you tell me whether they have this morning?
I just explained to you that when I became aware of them at the end of last year, I took that matter up with the Minister of Health.
Yes, but what's being done about it, Minister?
Well, I've told you what I have done, and I've explained to you what the statutory obligations are on the Director General of Health and the Director of Mental Health. And there's nothing that has suggested to me since that they're not meeting those statutory obligations.
OK. All right, let's move on, because there's a big shake-up to the health system coming. Obviously, the DHBs will be no more, and there will be a big new fandangled health system under Health New Zealand. When do you expect that our emergency department wait times will be reduced as a result of this? When will the wait times for operations be reduced as a result of this change?
Well, the wait times in EDs are starting to fall away already, because what compounded the situation over the last 2 or 3 weeks was a combination of There's still elevated levels of COVID. There are much higher levels of influenza illnesses that weren't expected at this particular time, and the much higher levels of staff absenteeism. Those things are all starting to change already. What I expect from the reforms is that with one decision maker, with one body responsible for the entire hospital network, is that we can streamline decisions and make decisions much more effectively to fill the gaps, to make the decisions that are needed to fix the problems that are in the system, many of which have been around for some time, but with 20 different decision makers and a ministry and a number of other organisations simply not able to coordinate and cohere effectively. That will change.
Okay, so you're saying actually in the short term we're going to see some relief at the emergency departments. I just want to read you from the Whangarei head of the emergency department, Gary Payenda, who said, this is in Northland, who said people are regularly, right now, being treated in corridors and in chairs. There are many patients who are sick enough to be admitted who have to wait 24 hours for a bed. You're saying in the short term that problem should be gone.
Yeah, I saw Gary's comments yesterday, and I understood what he was saying is that in the situation we have at the moment, with the combination of COVID, influenza-like illnesses, the fact that you've got some smaller age residential care places who can't cope with the people they've got and having to send people off to hospital, that has put pressure on some of our hospitals over the last sort of 2, 3, maybe 4 weeks. That situation is already dissipating. But in terms of the long term, what I might describe as chronic problems, the fact that we have a lot of vacancies, particularly for nurses, a lot of vacancies for other medical professional positions. We now have, with one organisation responsible for recruiting into those roles rather than 20, all in the same market, all trying to fix their problems in their patch. We can now get some coordination and coherence to addressing those problems.
Okay, it's interesting to hear you say that these problems at ED will dissipate just as winter is starting, so we will definitely be checking back in with you on that one as we head further into winter. Just when it comes to the reason for that, you've mentioned the flu and you've mentioned COVID. You're saying, because none of the reasons you've given are staffing shortages, which is quite deliberate on your point, you're saying that none of these problems are because we don't have enough staff or beds.
No, I haven't said that. I've acknowledged that there are staff vacancies. We know that there are staff vacancies. We also know that
is that playing a
we also know
part
that there's been yes, they will have done, and that's why the level of staff absenteeism that hospitals have been experiencing. One hospital last week saying on one day 15% of staff were absent. That is bad enough on any day. When you've also got vacancies on top of that, that compounds that problem. The vacancies are very much part of the problem.
Should we have listened to the DHBs then when they said, let more nurses into the country, create the pathway?
Yeah, we were listening to the DHBs, and that's why during the period of COVID, when the borders were closed, we had of about over 5,000 health professionals who crossed the border when the borders were closed. Over 2,000 of them were nurses.
So you're saying that we filled all the gaps we needed to because of your lenient border policies?
No, that's not what I said at all. You're putting words in my mouth. What I've said is that when we closed the borders in order to minimise the transmission of COVID from overseas and what have you, we had a number of exceptions. Healthcare workers was one of those. During the 2 years, the borders were pretty much closed. Over 5,000 healthcare workers from people employed by hospitals, by aged residential care, by primary care, crossed the border. Over 2,000 of those were nurses. The reason why chief executives of the DHBs wrote to the head of the Ministry of Business, Innovation and Employment last year is because the MIQ system, which was meant to be specifically facilitating health workers crossing the border, had kind of got clogged up, and the guarantees of guaranteed places clearly was not apparent. I found that as I intervened at least 3 times with both private and public health employers who couldn't understand why they couldn't get places. And when I took those issues up, I was told, yes, there are places. It turned out there weren't. And we fixed that problem in October last year, and that's why we got the guaranteed 300 places for health workers in the MIQ system at that time.
All right, just really quickly before we go, you said we'd had 2,000 nurses come into the country during COVID. How many left?
Well, I'm not quite sure how many left.
Okay.
I was more concerned about the ones that we were recruiting into our system.
Yeah,